Today we're going to chat about leg veins, because as much as we care about aging in our face, the reality is that collagen and elastin is causing our whole body to age. And a lot of women come in saying, they had great legs when they were younger, and now that they're getting older, they've got this network of veins showing up on their legs. And why? Veins are made up of collagen and elastin, and what that does in a vein is it helps it keep its shape. As we get older, this weakens. So with loss of collagen in the skin, which makes the skin thinner, and then these veins that don't hold the blood in as well, we get pooling of the veins. And then we start to see them as this ugly blue network of roads on our gorgeous legs. And if any of you are in the habit of doing this ice cold swimming, I'm sure you'll notice that once you get out the water, the veins actually improve. So they tend to flux as you have heat. So, obviously you get women who have veins that show up after pregnancy, or if they have trauma, or, just if they're predisposed with genetics, they've had them since maybe their teens or 20s. There's certain people who are predisposed, and they often seek out help younger. But then you get the population who gets older, who notices as they get to their 40s or 50s, they start to notice that from having one or two little veins on their legs, they now have a whole network of veins. Instead of these lovely limbs, they feel like they've got these road maps. And that can actually make you feel quite self-conscious when you're just wanting to wear your usual shorts or dresses. And I think it's quite a shame feeling like you have to hide your legs as you get older. Let me tell you about the causes and what exacerbates spider veins and varicose veins. You'll see the women who get them when they're younger, generally it's genetic. They'll say their mother or their granny, they had them and they're bound to get them. You'll also notice more women than men complain about varicose veins and spider veins, and that's because we've got lots of estrogen. For some reason, our hormones increase our chance of getting them. Pregnancy, being overweight, standing a lot or sitting a lot, these are all things that will exacerbate your chances of forming varicose veins These are all things that will exacerbate your risk of getting worsening spider veins or varicose veins. Sometimes they can be a trauma. I've had patients where as a teenager they got hit with a hockey ball, and since then they've had a massive kind of eruption of leg veins on one side. For me, warning signs would be if you suddenly developed an array of either spider veins or tender varicose vein in an area. That needs fairly urgent assessment, because sometimes a deep vein thrombosis can present as more visible varicose veins or spider veins, and that needs fairly urgent assessment. So we've chatted about leg veins and why you get them, but what do you do about them? With the two different types of leg veins, the superficial spider veins and the more prominent varicose veins, there really are two modalities we use. The most common and kind of gold standard for your spider veins would be your sclerotherapy. And this is something I perform regularly in my practice. It's for those veins that almost make like a spider web on the skin. They're very fine, they don't usually have symptoms attached with them, they really just are unsightly. And this is a very straightforward treatment that we do. It's very low risk, and the name sclerotherapy gets its name from the sclerosant, which is a soapy-like substance we inject into the blood vessel, and this pushes out the blood and irritates the lining of the blood vessels, which then sticks together. And because you're not using your vein, your body then digest and get rid of the vein. It's generally permanent, but it often needs about 2 to 4 treatments before you get complete removal of the superficial veins on the leg. Other common treatments we use for spider veins are your laser therapies, and this I find is best for those really fine little red veins, which are often quite difficult to get into with a needle. Varicose veins are a little trickier. they're bigger veins, they're often bulging. In more extreme cases, you can have discoloration of your leg, you can have ulcers forming, and these are generally related to an issue with your valves. So valves are really important to stop the blood from flowing backwards into the deeper system. And with age, with genetics, with high blood pressure, with a number of different problems, these valves become incompetent. In more complex cases, I prefer to send patients to a vascular surgeon so that you can have a proper ultrasound and assessment of these veins. I'm going to stick to sclerotherapy today when discussing the possible risks involved with it, as this is generally my frame of reference. So what can you expect from sclerotherapy? Immediately after the treatment, you'll see that there might be fine little bumps where I've injected. And these can often be a little itchy. And it might just be that the bit of the sclerosing agent has leaked into the skin and your body just is having a little reaction to it. Other than that, you can have a little bit of swelling. And because we're injecting with a needle, you'll most likely get a little bit of bruising, but this fades with time. Immediately you won't feel much. I get you to wear stockings for 2 days to 2 weeks, depending on how big your veins are. And we recommend that you walk for 20 minutes a day, straight after the treatment for 2 weeks. And during that time, you might have a bit of throbbing in your legs, you might have a bit of pins and needles, but on the whole, it's generally a straightforward treatment. So now I've just injected you. What do you do next? Let's chat about home care. Compression stockings are the most important thing to wear after a sclerotherapy treatment. You wear them for 2 to 14 days, depending on what your practitioner recommends. Generally, spider veins need 2 days, varicose veins need 2 weeks. If a patient cannot walk for 20 minutes a day for 2 weeks, then I won't inject them. It's so important for your circulation to prevent clots and just help with the procedure. We suggest to avoid sit-ups, any high-intensity exercise for at least 2 weeks. Anything that's going to increase pressure on your mid-portion and backflow on your blood vessels is going to interfere with the efficacy of the treatment. So ideally, we like you to walk and just keep it low-key and avoid saunas, hot baths, and anything that's just going to just create some stagnation in your lower legs. So when we do the initial consult, it's really important to bring all your information to the doctor, because although sclerotherapy is a very straightforward treatment, there are certain patients who are not good candidates for it. Anyone with a history of clotting is at a higher risk of a deep vein thrombosis if we go and inject into your veins. Any bleeding disorders, any allergies to the sclerosant, these are important things we need to chat about, because there is a very, very, very small risk when you have the sclerotherapy that you can have a clot forming in the leg, and that can even break off and go to the lung. It's such a small risk, but we decrease the risk even further by taking a good history and knowing your background. While sclerotherapy has a high success rate with very little risk involved, there are potential risks with it. Probably the most common is bruising and a bit of swelling and discomfort. However, you can get something called telangiectatic matting, which is basically where we treat one area that's weak, but you actually have another little area that's weak that's hiding underneath. And then we block that pathway so the blood just goes through the other pathway. And it's pretty mild in terms of side effects, because then we just go back and treat the area that's shut up. You can get an allergic reaction to the sclerosing agent, and in very rare circumstances, you can get a clot that forms in your superficial blood vessels that then passes on to your deeper vessels. So, you're probably wondering, is this sore? Compared to laser vein removal, patients have said that sclerotherapy is not that bad. It does involve lots of little pricks, but I find generally patients complain more in areas around the knee or the inner thigh, areas where we tend to be a lot more sensitive. On the whole, it's pretty straightforward. Some patients who have varicose veins treated, you might get a superficial blood clot where the vessel spasmed and trapped a bit of blood in it. Often these patients come 2 weeks later and have to remove that little clot by putting a needle into the skin, and that can be a bit uncomfortable. But on the whole, patients are happy because they have, for very little discomfort, they have lovely vein-free legs. It permanently treats veins. However, if you're prone to getting varicose veins or spider veins, more will appear, and you just treat them as they come. You know, a lot of people, you get those women who in their 20s and 30s, they've got veins, and that's genetics. But a lot of women, it's because we're aging and we're losing a bit of fat in our superficial tissue, our skin's getting thinner, our veins are weaker, so the backflow of pressure, we get more pooling out of these vessels, and it just makes sense why we're getting them and why we need to treat them if we want them to improve. And I actually had someone recently who came to me, and this incredible woman who had experienced a lot of loss in her life. She's in her late 50s, almost 60. And she's just this incredible figure, but completely modest. And she was on this journey of investing in herself, and she wanted me to treat some leg veins. And then she came back for follow-up a month later, and she said that one of her friends was like, "Why are you doing this? Why are you spending money on your legs? Who are you trying to impress?" And we just had a good chat because it was quite a moment for her, because she just said to her friend, "You know, I'm doing this for me. This is part of my journey. I get to see my legs every day." And I think a lot of the people we're around, they're well-meaning, but they tend to say things that undermine your self-care journey. And yes, they're leg veins. Some people have them and don't bother about them. Other people, it reminds them of their granny and how old their granny was, and it starts to make you feel like you've got these old legs you don't want to show off. And especially this patient had better legs than mine, and she was 20 years older than me, but felt like she had started to dress to hide her legs. And just the confidence in her coming back, treating the last little ones, was so beautiful to be a part of. And you know, yeah, it's leg veins, and who cares? But if you do, it's like so nice to do something about it. It's such an easy treatment.